Hi, my name is Tammy Fuller. I'm the Pediatric Clinical Care Coordinator, and I'm here today to teach you a little bit about when your patients are coming in and they're being converted from a PEG tube to a low profile Mickey or an AMT Mini. So really what we want the parents to know is how to clean the site, how to turn it, and how to give feedings and meds through it, and how to check the balloon. So your parents have already had a lot of experience working with feedings and medications using the PEG tube. So what they want to know is how to clean, and basically it's the same as the PEG tube. They're going to clean with, for the first couple of days, I would have them just clean with like sterile water or sterile saline around the site with a Q-tip, because there may be a little bit of drainage, a little bit of bleeding from the conversion. I don't always see that though. Sometimes it's a nice conversion, everything goes well, and there's no drainage whatsoever. But that skin around there may be just a little bit sensitive from manipulation from pulling the PEG tube out. So after that though, they can clean with just normal mild soap and water, dry really well around the stoma site, and then each day they're going to turn the tube just like they did with the PEG tube. They're going to do one full rotation. What that does is to prevent the skin from adhering to the plastic on the tube and causing problems. So then the next thing that they need to do is they should have, my kit's a little tore up a little bit, sorry, it's been used multiple times, but they should have their kit that they got that contained the low profile tube to begin with, and this should go home with them. Within the kit are the syringes and the extension tubing that they need to give meds and feeds, and then a syringe to check placement or water in the balloon. So the next thing I want you to teach them is on a weekly basis, they should be checking how much water is in their balloon. If they notice that for some reason the button isn't sitting down snug against the skin like it used to, or there's some stomach content coming out, that's the first thing they should check, is how much water is in my balloon. And in the pamphlet that comes with their tube or on the outside, it should tell you how much water is instilled in the balloon. And it's usually 3 to 5 mLs of water for the pediatric patients. Sometimes when you're getting up into the bigger tubes and the larger kids, you can go up to 10. But for the littles, it's usually 3 to 5. So you want them to show them how to use their slip tip syringe to go into the balloon and check and verify that they have the 3 or the 5 mLs of water. If they do, then they just push that back in and they're good to go. If they don't, either Dr. Zadie's office or if should have ordered supplies for them at home, which includes a backup G-tube that's the same size as what they have in, and then sterile water with slip tip syringes and the access devices. So just show them how to use that access device, their syringe, to pull up the sterile water, and then whatever amount is missing from their balloon, they would instill into the balloon to get it to the 3 to 5 mLs of water, okay? So the next thing that you want to teach them that they're like, I don't know how to work the extension tubing. So this is called a Y-port extension tubing, and it's because it kind of comes down into a, it's not up and down straight like this one. Okay, this is more for like a bolus type feeding. This can also be used, sometimes we'll use it to decompress the G-tube if we need to. So just make sure that you tell the parents that there is a little bit of difference. This can be used for bolus feeds, this one that kind of has a 90-degree angle. So you want to, there's a little black line on it, and there's a little black line on the low profile tube. And you're going to line up those little black lines and pop the extension tubing in. And then you're going to give it a full 180-degree turn. And that, or even 360, that locks that into place. The big thing is that you want to make sure that you tell them, make sure you've got this clamped, because if you open it, then stomach contents or whatever you've put in can come back out. And then they can either flush, really actually, I'm going to back up a little bit. Before you have them connect, what we usually do here is we'll have them flush with a little bit of either purified water or sterile water, depending on the age, so that they get the water down to the end of the tube and then clamp it. Because that primes the tubing and they're not pushing all that air into their child's tummy, because we all know that none of us like it when we get a whole bunch of air in our tummy. That hurts and they're going to be cranky. So just have them prime that first. Then they can connect and lock, and then they're good to go. They can either hook up their syringe for their feeding. Some of the kids will get gravity fed and all they're going to use is the syringe, and they would just take their plunger out, and they get this concept. Really the big thing is knowing how to connect the extension tubing so that and priming it so that they can connect either their syringe or their feeding bag. And tell them that this looks just like the PEG tube. This top part is for feeding and the side port is for medication administration, okay? And then again, this other size tube would be for either, you can use it for bolus feeds, like if maybe they're just getting a water flush because they have to have free water for the day. They would just connect their syringe to that, pour in a little bit of water, let it go in, clamp, and then disconnect. Or they could put this together and connect it to the syringe, or sometimes we have decompression bags called ferrule tubes, and you can connect that here to this also, or ferrule bags. So this is kind of a decompression kind of a tube. So these are two useful things to use. The other thing that I remind parents of, just like with the PEG tube, that if it gets pulled out, there's a small window of time that they need to seek help to get it replaced. So they can either try to deflate the balloon and pop this back in, because by that time they have a stoma that's been well formed, or they can cover it with gauze if they don't feel comfortable, or if it won't go right back in, and then call Dr. Zadie's office or the provider that switched them to the low profile tube, or bring them to the ER right away. If the office is open, sometimes that's a better option, because they'll just get them in, the nurse will put it back in, and they're on their way. They don't have to have a big wait in the ER, nor do they get exposed to all the sick people and whatever else is down in the ER. If the office is not open, then obviously they have to come to the ER to have it replaced. We are to be training the families to bring in their extra kit so that they can, it's a great time then just to change out the tube and start fresh. Because sometimes it's difficult once that balloon has been inflated with the water. It doesn't always like to go back down well enough to nicely go into the stoma site. So just tell them they can't do any, they can't get anything in there. Cover it, bring them, and then bring their kit with them so that you have something to put back in their tummy when they arrive. So that's really it. The only other thing that I talk to them about is, just like with the PEG tube, always watch for signs and symptoms of infection around the stoma site, any redness, any swelling, any abnormal drainage, any abnormal skin growth, which is sometimes that's normal. It's called a granuloma, and that does occur. And if it gets too bad, the physician can use silver nitrate or whatever to help that to heal and repair. And if they have any signs or symptoms of infection, that they should call the provider that helps them to take care of their tube. And then just ensure that they have supplies at home, that the office has ordered those. If they have not gotten those, then please tell the family to contact Dr. Zadie's office or the provider that placed the low profile to get those supplies ordered for them. And then you can always give them, well, if they're not coming to the floor, I won't have any connection with them. I won't even know that they're here. So, but I'm always a resource for you guys or your patients. You can Doc Halo me. I 99.9% of the time will answer those unless I don't have service to my phone. And we'll try to either connect you with somebody that can help you, or I will try to walk through a process with you. So let me know if you have any questions or concerns. My number is 647-7914. I am going to be making a quick sheet with this information on it for you guys as well, and I'll supply that to Sarah as soon as I have that developed. So thanks, have a great day.